My name is Alex Scott. I'm the branch secretary of the Together Union, and I'll be undertaking today's public service briefing. We will be trying to keep it to half an hour in line with previous briefings to maximise people's involvement, and we'll try and have an opportunity for people to follow up with the questions they've asked online before the meeting. If they're not covered during the briefing, we'll do that after the meeting, but also try and cover most of the questions that people have had during the session itself. Before I'd start, I'd like to acknowledge the traditional owners on the land on which we're meeting across the state today and pay my respects to their elders past, present and emerging. In terms of today's session, the majority of the time we want to spend talking about is in relation to the issue of COVID vaccinations and mandation of vaccinations across the Queensland Public Service. At the briefing session last month, we talked about where we felt it was likely to go in terms of the broader conversation around mandation, and we're now in a position to have a much better understanding of the likely processes from here for the public service, as well as briefing you on the emerging court cases in relation to mandation. At the first level, Together is a strong public health union, and we have supported the campaign by the Queensland Government and the Australian Government and health authorities to encourage vaccinations. We think it is part of the broader pandemic response. It won't eliminate COVID, but it certainly will reduce the impact on the Queensland community, and we support, as a general concept, vaccinations as part of the solution towards our response to the pandemic. As part of that, we have been advocating for a number of months that the government needs to do more to encourage public sector workers to be vaccinated, and after some significant pressure over those months, we now have seen the government not only deal with the issue of leave for people who are affected by COVID and the after effects of the vaccination, but also providing people with paid time in relation to getting vaccinated. So you should have seen that coming through from your Directors General in a joint message from the Public Service Commissioner. And in terms of that process, we're keen to work out exactly how well that has been is occurring across the sector, and particularly in terms of the ability of public servants to actually practically get access to that vaccination process. So first of all, we'll be asking people as part of today's session to let us know where they are able to get vaccinated on work time, but also because we'll be able to record where these questions are coming from, the answers are coming from, identifying which agencies are continuing to be a challenge in relation to access. More importantly, as we move forward, is the question in relation to beyond those people who are willing to be vaccinated, what is going to happen in relation to the potential for the employer to force vaccinations to occur for workers. And in terms of that process, there is a variety of ways that vaccinations could be mandated within the system by employers or by government. And our position as public sector workers is a bit confused because our employer is also the government. In terms of that, there is the Chief Health Officer has made a number of directions during the pandemic in relation to lockdown, in relation to masks, in relation to hospital visits and aged care visits. And they've done that through health directives, which are CHO directives, Chief Health Officer directives. And that is one of the ways that vaccinations can be mandated in requiring that anybody who is working in the workforce can be required by the Chief Health Officer to apply to be vaccinated to be able to continue that work. Secondly, there is the ability as public sector workers to have vaccinations required in terms of a process, potentially required in relation to the employer using powers that they have because of the public sector legislation that you're employed under gives your Director General or equivalent CEO certain powers and responsibilities. So there is the ability in that space for the potential for workers to be required to be vaccinated if the employer chooses to use some of that policy. Whether that's legal or not is subject to further discussion and further court cases, but there is a head of power that the employers in public sector have, both through legislation and delegated legislation, which we'll talk about a bit more as we move forward. And the third level is the ability for employers through their workplace health and safety requirements, both public and private sector, to seek mandation of vaccinations, and whether that will be one of the other options that might be considered by employers if they seek to go down the mandation model. So there are three distinct heads of power that might be used in any conversation in any agency in relation to that. What that looks like in other states has been that you may have seen that there is a very broad process in relation to vaccinations within large parts of Victoria. Most of those vaccination requirements are coming from the Chief Health Officer in that state. So it's not that while they are being issued by the state government, they are being issued through the public health powers rather than their employer powers. Then there is a second range of which is occurring in the private sector, both nationally and elsewhere, which is using the powers as an employer to try and say we're under the workplace health and safety legislation that they will be seeking that their staff be mandated. So if we see conversations from Qantas or announcements from other private sector employers, they're seeking in the private sector to use general powers in relation to workplace health and safety to provide a safe workplace, to say that that is why they would be seeking to mandate that their staff are fully vaccinated. In terms of the private sector powers, which exist for all employers, that is clearly untested law at this point in time. It is quite clear that employers' upon engagement can set what that they are acquiring before you apply for a job, that you have to have certain requirements. And so it's quite clear in our view that if you, before you're employed, they can say, if you want to apply for a job with us, you have to be vaccinated, and they can choose not to give you the job if you're not vaccinated, and they only employ people who are vaccinated moving forward. That's very different, though, from the rights of existing employees if the employer is seeking to change the working conditions that you have as a result of workplace health and safety. So in terms of that, what we're seeing at the moment, there has been a number of cases taken around flu vaccinations, and there's one particular one in relation to aged care that has been quoted a lot. That's been quoted a lot because it's a decision where the majority of the Fair Work Commission said it was okay to require a flu vaccination and dismiss someone for a variety of circumstances because they didn't have a flu vaccination. The dissenting person in that case, Commissioner, made a number of comments about why it wasn't appropriate to have COVID vaccinations mandated, but that actually wasn't the substance of the case, and it was also not the major decision. So the majority decision of the Fair Work Commission in that case actually made no reference to COVID and was quite specific about flu vaccinations, but we're seeing quite a lot of commentary in social media quoting the dissenting decision about a theoretical conversation around COVID. So at this point in time, there hasn't been well-established case law in relation to what the rights and entitlements for the employer are in relation to changing your conditions of employment by forced vaccination. There are cases on foot at the moment, but those cases haven't been decided. In relation to the public sector in Queensland, we have seen the two of the three major employers mandating the requirement for vaccinations for their workforce, or the vast majority of their workforce. In terms of that, that is in relation to Queensland Health, and that's really a CHO decision in relation to Queensland Health and using their powers in that space, but also in relation to the Queensland Police Service. The Police Commissioner has made a direction. Those directions are specific directions that they have powers which are unique to their employer under the Police Service Administration Health and the Health Act. So in terms of that, those powers don't exist necessarily in the public service. So public service departments are created under the Public Service Act. The DG has powers under the Public Service Act to do a range of things. But in the Police Commissioner's circumstance and the Health Director General circumstance, they have far more broad sweeping powers under their Act than is available under the Public Service Act. So at the moment, those decisions are subject to court challenge. There was a hearing yesterday in the Supreme Court about that. There's a full hearing, I think, on the 18th of October in relation to that. My understanding about the hearings yesterday was that there has been a narrowing of the decisions in relation to the Supreme Court. So it's about a named number of individuals have challenged those decisions. my understanding, which may be correct or not, is that the case going forward, as reported in the media, and from what I understand from people who attended that case, but I haven't seen the written decision, was it's now about the named individuals rather than the power itself as to where that goes. So we are at a critical juncture in terms of the powers of the public sector in relation to mandating, and I think it's unlikely that we will see significant movement from other government departments until they see the outcome of that Supreme Court decision. But I think it's also likely that in terms of that process, that the Supreme Court decision might rule out the powers that the Police Commissioner and the Director General have used. I think that's probably unlikely, but it is possible. But even if they do rule those, if they rule the powers possible to be used, it doesn't necessarily mean that Director Generals of other departments can do the same thing, because they haven't got the same legislative powers that the Police Commissioner does and the Director General of Health do. So what we would be expecting in terms of this process is more likely that we will see a decision by the Supreme Court in relation to whether the Police Commissioner and or the Director General of Health have overstepped their powers in relation to mandating. We think it's unlikely. We think it's likely the court, based on their powers, is probably going to be able to continue with that decision, but we won't see that for the next couple of weeks. But I think then if the government's position is upheld by the courts, then the discussion will happen arranged in relation to what's going to happen with other government departments. Because in my view, I think it's going to be practically impossible to say that police and health have mandate, if they are successful, the COVID for their workforce, when we have an intermingled workforce in a range of places, both in health and police. So I think there is then going to be a conversation at the Director General level as to whether or not they would then be seeking to mandate some or all of their workforces, but it's probable that that discussion will be happening under the workplace health and safety powers, which they have in relation to saying that they have to provide a safe workplace. So at this point in time, what we would be expecting, and what we've said to the departments, is rather than waiting till the 18th of October and the decisions there, the government needs to start having a conversation with its workforce about this issue. We think it is being delayed because of the kind of unknown of those existing court cases, but we don't think either way, no matter what happens in those court cases, that we will see that being the end of the conversation, because we would then be looking at what happens in terms of workplace health and safety and whether government departments seek to do that. Generally, from a union perspective, we think that that's got to be very carefully handled, and we want to make sure that the inappropriate decisions aren't made. In terms of what that looks like, we have suggested that it would be appropriate to try and take a sector-wide view of this, rather than each department having its own adventure in terms of how it approaches the workplace health and safety legislation and what it looks like then in terms of its implementation. We have met with the Public Service Commissioner about that, and we have met with a number of Directors General about that as late as this morning, and will continue to do so. I think that there is a point where it is a difficult conversation for the government to have with its workforce, and so that hasn't been occurring. And I think there is still risks that there will be a department by department approach implemented. We have called for a core public service EB consultative forum, which we think will be happening next Thursday, which will provide us with a framework for conversations with the government. Hopefully that will provide a sector-wide framework to say, not that there'll be a sector-wide decision, but each DG will have an agreed framework for that conversation with the union members in their workplace, and we're being able to work that through. We will then, as a union, having to work with members to determine what our view is in relation to that. And then particularly thinking through whether this is going to be an issue in your workplaces. Clearly, some agencies are going to be more likely to be engaging in that conversation. It's clearly already a part of a conversation in places like child safety, corrections, youth justice, and the such like. Other more white collar CBD type departments are less likely to be in this space, but we certainly think a single approach for 1 William Street would be kind of appropriate and rational. Whether the government gets to that point, we're still not completely clear or not certain. But I think in terms of that process, what we need to get from members is really a question in relation to the fact that they are likely to mandate for new employees, but whether they mandate for existing employees, and then particularly then what that looks like. From our point of view in the union office, we're working closely with members to be part of that process and support that conversation, but then also making sure that we're able to support people through that process. Because what we also know in terms of the vaccination program, that at some point Queensland will open up again, depending on the targets hit in terms of vaccination, and that will see a significant spike in the number of cases as the borders are unlocked. Everybody I think now recognises that vaccinations aren't going to eliminate COVID, they're just going to mitigate it, and particularly the broader conversation around the curve and flattening that. And we've been working with our members in Queensland Health in particular to make sure that the health system is fully resourced in terms of post the borders coming down to be able to actually deal with a significant increase in the number of cases and the severity of those cases, particularly in the unvaccinated part of the population, which will be 10–20% at that point in time. And so that is going to be an issue. But we're also keen to make sure that in terms of those areas of the public sector, which we would expect to be the majority still, where mandation hasn't been required, that what that looks like in the workplace, and ensuring that there isn't looking at what the mental health issues for the members are, and also the potential for challenges within the workplace where we have vaccinated and unvaccinated members working with each other, and ensuring that that doesn't become a source of disputation within workplaces. So that's going to be a significant component of our program, and then thinking through at the agency level, hopefully having got the government to being in a position of setting the ground rules for decision making centrally, so good quality decision making happens, but that would still require department by department directors general to work through what are the workplace health and safety risks in that process, and consult with their workforce as part of that. So at that point in time, we'll be talking to union members about it. Broadly, we've been getting the feedback from most agencies that members support vaccinations on the whole. There are significant numbers of members who are concerned about their health issues, but also have philosophical questions about the nature of the vaccination program. We'll be supporting members through that, but we'll also then be having to work out as if employers come to us as workers and say, what is our view? That will be an agency by agency issue, and we're looking at making sure the decisions are made well, that our voice as union members is heard in it, and also that if mandation does occur in workplaces, that the individual rights of workers are fully protected in that space. So I think we're still probably a couple of weeks away from that happening in a significant sense. I think that the kind of Supreme Court action will set part of that framework. I'm hoping by the end of next week, government will see sense and look at a more centralised approach, at least on discussion about what the rules and processes of decision making are. And that will then allow us to engage with the employer on a department by department basis, knowing what the rules are and having a consistent view in relation to what the law says, and then seeing what the employer says in relation to mandation, and also making sure that there is quality decisions made that balances the rights of the individual, but also make sure that they're making decisions that are the best decisions moving forward, and that the workers' voices are heard in that. So that'll be, I think, probably still agency by agency, but I would hope to have more detail once those Supreme Court decisions are made, but also once we start to see some fair work decisions come out in the private sector. They won't have absolute precedent, but they will have significant precedent for the Industrial Relations Commission, which covers you in the state jurisdiction, and it's the QIRC, which would be the appeal body which we would seek to use if we dispute decisions made by the government, department by department, using the workplace health and safety legislation appropriately or inappropriately in relation to mandating. So it is a continuing conversation. The law isn't well established yet. The law will be established through the cases that are decided. There will be decisions decided by the Supreme Court in relation to particularly the Police Commissioner's decision. That will have some impact on the rest of the public service. There will be fair work decisions which are in the pipeline that will have some impact in relation to the use of the workplace health and safety powers. And then there will be some decisions made by departments if they do seek to mandate and what that looks like. And those will then be subject to a potential challenge through the Industrial Relations Commission, which will be likely to be taking on, but not required to take on, precedent through the Fair Work jurisdiction. In terms of then the other parts of the industrial conversation that we've been having with the public sector at the moment has been the issue of working from home. And that has been an ongoing discussion we briefed people on previously. In terms of that process, there has been a significant decision made in relation to the Hume decision that we have spoken about previously, which does set good precedent. We do have a meeting this afternoon with government to see whether they're willing to then use that precedent to re-establish a better set of regulation in relation to working from home. I'm not confident that will get over the line in terms of that process. There continues to be significant pushback from government departments, or some departments saying they like the current process. If those negotiations will then escalate to the Central Consultative Forum next week, and there'll have to be a decision made after that about whether there is an option of a better regulation structure and a better team-based process to work out how government departments are making appropriate decisions. If the government doesn't make us a good enough offer at that point in time for an alternative regulatory system for working from home, we'll be then looking to prosecute a number of cases through the Industrial Relations Commission on the back of the Hume precedent, which we think would shift substantially the power back to workers in relation to the ability to work from home in a hybrid model, and particularly looking at that in a kind of 2020 sense rather than looking at what happened in 2020 during the COVID lockdown. I think that would be better than the current position being put by most government departments, but I think the risk with that strategy would be a case-by-case one, and it would be seeking to establish what is case law in relation to your rights working from home. And while the Hume decision is a good decision, there is no guarantee that other commissioners would make the same quality decision. So we would end up going through a period of significant variation on a case-by-case basis. I think a centrally negotiated outcome, if it's good enough, is better than that, but we'll be coming back to you after next week to see exactly what is an offer from government, and then potentially doing another Zoom in relation to particularly just work from home and those people who are wanting to have the working from home arrangements as a specific issue for them, about whether we then look at the kind of bulk applications and appeals through the Hume process. We've already laid the groundwork for that, writing to every agency, confirming what their appeal structures would look like. In that regard, we've had no response to that from any agency, but that is to be expected in terms of the nature of those industrial conversations. And we will, over the next, I think, 7 days, either be at a point of considering an option put to us by government, or looking at, as we did with the temporary and conversions and the higher duty conversions, looking at prosecuting a significant number of individual cases to demonstrate to the government that the Industrial Commission is more of our view of workers' rights than the current approach being taken by particular departments and by the Public Service Commission. So I think that's probably in a similar time frame to the COVID process, but probably a week earlier than that. In terms of the other major issues that we wanted to flag today was in relation to the Public Service Review. The review of that Act is well on track. We are continuing to be consulted through the Joint Advisory Committee, and we would expect that that will then now go back to Cabinet for drafting, and that is reasonably well established, I think, in terms of we'll see early next year a significant move in relation to most of the issues that we were seeking to prosecute about improving members' working rights. I think one of the areas that isn't well established yet, and we'll be seeking to work with members over the next couple of months, is while they move to the drafting phase of the Act, I think particularly the issue of what public sector workers' rights are in relation to the ability for private comment, particularly private comment on social media. needs to be further developed. There is a decision in the High Court in relation to the Federal Public Service that basically gives significant powers through the Code of Conduct to the employer to reach in beyond the employment relationship as we traditionally would have seen it, to try and muzzle the ability of public sector workers to have the right, particularly for political comment, but also for broader community comment outside of your working environment, and not as speaking as a departmental employee, but speaking as a member of the community. I think certainly if that High Court is unchallenged and not dealt with in a legislative sense, we would then be seeing that there would be, that I think having legislative protections is better than letting the High Court alone decide that. But how far we can get in terms of getting a guarantee in the rewrite of the Public Service Act, I think the government hasn't got a strong view yet, but I think we need to develop a clear set of claims in relation to that to make sure that any change to the Act addresses that High Court precedent head on, rather than allowing the case law to allow to deal with it. The second issue that I think that we would be working on will be issues in relation to the review, the recruitment and selection process. The union got commitments from the government about the review of the Act, about the review of temporary employment, but we also got a commitment around the review of the recruitment selection process. That was done by the Public Service Commission rather than through the rewrite of the Public Service Act process. And that had a 12-month timeframe on it, and that kind of a draft report has now been developed. I think from our point of view, we'll be seeking to extend that process for a further 12 months. So decoupling the review of the recruitment selection process from the review of the Act. One of the major reasons for that will be in relation to looking at the review that is currently has been announced in relation to the CCC, which has said that they will be undertaking an audit of the way that the potential for corruption during recruitment and selection in the public sector. Our view, or my personal recommendation, is I think that not finalising the Public Service Commission review until we've seen what the CCC says would be appropriate. I think that previously members have indicated they don't have strong confidence in the current processes. So in terms of that process, we would be seeking to more substantially challenge the use of power by the employer in recruitment selection. And I think potentially the CCC will be capable of being supportive of our broader position in that regard. And hopefully that would allow us to better prosecute an argument for more oversight and more transparency about how recruitment and selection is done. There is a risk to that in that that there will be one legislative round undertaken for tabling early next year with the Public Service Act. I think after the CCC and the Public Service Commission review of recruitment selection, we would then potentially be seeking better engagement and further changes to the Act. But my general view is that is it's better to do that rather than trying to finalise the recruitment selection review and say that this review of the Public Service Act deals with our questions, and then in June have the CCC come out with recommendations that we support, but then be told, well, we've already had our attempt at rewriting the legislation, so that we're not able to do that. So that's really where we're at with that process. I think those two things will continue to be the process in terms of that. And then, sorry, just trying to work on that's where we think we'll be with the kind of the broader discussion around the recruitment and selection process. And I think with that particularly, we would then be wanting to think through not only thinking about what is the nature of the problems, but I think certainly in terms of a number of delegates have said to us during this process that we actually need to be taking a more engaged process, thinking about not just is the current process flawed in terms of manipulation, but how is the best way of finding the best people for the job? How is the best way of determining who gets promotions within the sector, and whether or not we need to be taking a more holistic view and coming up with more significant changes rather than adaptations, but having a clearer process of engaging with that. So what we'll be looking at doing is in going out to members and starting to say, not only do you think is the current process flawed or not, but do you think that there is the ability to have a completely revised process for recruitment selection? So particularly with things like directors general are being done by external recruitment companies, and therefore that whole recruitment process is excluded from the public sector oversight. And those processes, and so therefore whether we need a more significant process of engaging in terms of an alternative recruitment process and an alternative system and structure for the future. So what we'd be seeking to do that though is if we're going to argue that with government next year, we'll need to show that this is strongly felt by large numbers of public servants rather than just the union office speaking on workers' behalf. So what we'll be looking at doing later this year is seeking, and over the next couple of weeks, to if there is support from today and looking at it, there looks like there will be reasonable levels of support, trying to get engagement around that process. So we've got a number of members online who've indicated they're willing to do that, and that'll be really where we get to in terms of that process for that. So I know that's gone a couple of minutes over time today. We tried to do these on the first Wednesday of the month, but that became a bit of a difficulty with school holidays and public holidays. We'll probably be scheduling the next briefing on the 17th of November, which is about 4 weeks away. Hopefully by then we will have seen substantial movement in relation to COVID, and we will be able to give you more detailed understanding. We will continue to talk to you at a department by department level, but also then doing some sector-wide reporting back in mid-November, and also be in a position to report back in more detail around where we've got to in terms of the union negotiations on your behalf in relation to the Hume decision and working from home. So in terms of that process, thanks everybody for participating. I'm sorry I spoke a little bit fast today, but we wanted to try and get as much detail to you as we could on the COVID issue, and we will try and for those people who've submitted questions beforehand, we have previously failed to get back to you on answers to that because we had a system, we hadn't really picked up our internal processes, so we will get back to you for those questions. And there'll also be a follow-up email asking people about their views out of today, but also we'll be asking if you have questions at that point in time, there'll be an opportunity for you to have more specific questions in relation to how we've gone in terms of COVID, if there's other unanswered questions for you, and also if there are other questions you want the union office to do. So thanks everybody for participating today, and we will then try and continue to provide you with as much information as possible, and we'll talk to you again probably on work from home. We'll do a specific Zoom and then also then do another monthly update, but probably move it till the middle of the month rather than the first week of the month for November and December. Thank you everybody for your time, and we'll keep you informed as we can.